All right, what up? We're here.
Hi.
Hi, welcome back.
Yay. Welcome
I got,
back.
I
Yes.
got, I got my hot tea with ginger, mint, lemon, honey, and
Good
I
for
have my
you.
and I have my water.
Okay.
Okay, so listen, everybody knows daily we're doing the coronavirus crisis updates, letting people ask questions. Courtney Watson, tell everybody who you are, what you do, tell them your credentials so they know that this isn't, just a homie.
Hi, everyone. I'm Courtney Watson, sports medicine, working on my doctorate degree, one class away. Been the head athletic trainer and the director of sports medicine for the WNBA Los Angeles Sparks for 13 seasons now. Been working very closely with a lot of top medical professionals through USA Basketball and just through all of our professional doctors and therapist that works, with our sports and just with family practice overall. So thankful, happy to share information that I get. As you both, we've been talking for a little while now and seeing some of the trends and things that have happened over the course of the last couple of weeks for me, like the last few months or so, of just understanding what we're facing right now and how we can continue to live healthy and happy at home for a little while.
And you've been keeping me alive because I call you every day and ask you, what do I need to do to survive this?
Yep.
I'm happy to announce my anxiety has gone down
Yes.
because I'm
How?
staying
Let's
busy
talk
with
about, no, how, what did you do differently from yesterday to today? Because that's important.
pray. That's it. Just pray. Watch the movies, like literally just drank a lot of water, had a really good night's sleep. I think the thing that's important is that people need to not only keep their physical health in check, but their mental health as well, because the mind will start playing tricks on you. And then, what
Definitely the mind will. Yeah.
what up,
Good.
Godfrey? Okay, so I'm gonna give some updates on numbers. I know you hate numbers, but people want to
I
know
love
what's
numbers. It's
happening.
okay. I just like them to get them from you because you help me keep that part. I don't have to go and search for them because I know I can depend on you
Yeah.
to help me stay up on that part.
So I'm looking at the site. It says that there's 438,667 cases worldwide, but here in the U.S., it still shows that there's a spike, which we knew was going to happen. New York is up 4,400 cases by 16%, and California is up 3% with 77 new cases. It doesn't look like the curve is flattening yet, and I know, like we talked yesterday about the fact that the government doesn't seem to be shutting things down fast enough so people can get through this. But what are you hearing? Are there any new updates on what people are seeing? I know that there's a whole smell and taste issue now.
Yeah, there's been a few. I have 4 patients, friends, athletes that fit in that category of complaining to me about not being able to smell or taste food or to smell anything. So that was one of the signs, one of the symptoms that came up recently that a lot of the medical professionals that are studying the virus has seen in earlier stages of people that have coronavirus or maybe have not been tested, but there's some signs and symptoms of that as well. So just paying attention to the growth and the changes that happen and how that evolves from, where we started with understanding what symptomatic means, having those 3 symptoms that were necessary for you to go to the hospital or go to the doctor. And then the other stage where you're asymptomatic and you don't know really, which most of us don't know. And so now that all the testing is starting to pick up and then the results are returning back faster, those are the positive things. Remember, I just told you we got to stay positive. And so we just want to keep counting those things to make sure that we're seeing the progression of the recovered people as well as just some of the signs and symptoms of what to look for or what to feel or expect to help you kind of decide which road you should go down.
So we're getting tons of questions. So if that's okay, I'm gonna just jump right into the questions.
That's fine.
Okay. So this is a question that a lot of people are asking. We just kind of talked about: is loss of smell and taste really symptoms now of corona, or is it a sinus infection?
That's a great question because, prior to this coronavirus, a lot of people who have symptoms or illnesses, I'm one of them who've had pretty severe sinus infections. And, I think I've done a great job of getting back on top of that by working on my nutrition because diet is such an important role for understanding what you should eliminate or what you should add to your diet. But then we have to go back to just the overall understanding of, yeah, some trends that's happened. So when I started hearing or people were complaining to me, like I can't smell or taste my food over time, going back to my center with the doctors and talking about that those were some that had came up. And then within about the last 3 days or so, it's been pretty prevalent as far as everyone starting to connect those dots to see what exactly that means, or just understanding how long they have these symptoms. But yeah, it could be both, could be either one. I treat it as if it's a sinus infection when I started feeling my congestion or, needing to be, we're all inside most of the time. Hopefully we're practicing that, but yeah.
But
Is
loss of smell and taste though, is that a symptom or is it an effect of having the coronavirus?
That's a good question. I say that's more of a symptom. I mean, it's just the trends that we're seeing right now. There's nothing really been officially confirmed of that, but if we see, and I even think with a few of the celebrity clients that spoke out loud about it, they have noticed those are symptoms of, leading into that. Whether they have it or not at the time, they've noticed that I can't taste or smell food, which they normally are, or it comes back faster. So it's the amount of days in between that's making it be more of a symptom as opposed to just feeling like it's an infection or something that you've already experienced before. So I say treat it either way. Like, what do you normally do when you do have a sinus infection? Is it something that's severe case, or is it something that you can kind of monitor and maintain at home? Knowing the difference between those helps.
So now, is COVID-19 airborne? Because I know it is airborne, but people are also saying that you can touch something and catch it too. So is it both?
Yes, it's both. Airborne, that's why the social distancing is 6 feet, because it is airborne. So if you sneeze or cough and it spreads, that's the distance that it can travel. I mean, before this, being on a plane, because we travel so much, we feel that and see people from, it just showed that sneezing and coughing can kind of travel that far. So that's where the 6 feet comes from. But yes, it is airborne, and it also does live in fabric, on your body. And, one of the most common things now is on metal surfaces. So car doors, your doors at home. I spray them down with Lysol every day. Just try to get into those daily habits that we've been talking about over the last few days, like what makes sense to do like consistently every day. So yes, it does live on metal surfaces mostly for a long time.
So someone asked me this question. I can answer really quick. Is the Wild 'N Out show still happening since the coronavirus is announced? Yeah, MTV notified us that they moved the taping of Wild 'N Out to summertime. So we are going to do it, but we're going to do it later.
I love Wild 'N Out. I'm just saying, you guys do a great job. I watch that all the time, all the reruns, all the new ones. I look forward to seeing you. It's so funny, and I think we have to laugh and feel good from the inside. So watching shows like that, I applaud you guys for making us all sit there and laugh and sing along with all the things you guys have going on, because I
plan to go back season 5 and be even funnier and even more gay. So I'm looking forward to that. Okay. So someone asked, does the coronavirus last 3 minutes in the air? I thought it was 4 hours, up to 4 hours.
It is up to 4 hours. Recent research has shown it's been up to 4 hours, how long it's lasting. So we just go with what we know, the facts of it, as opposed to what everyone kind of starts to just put in our heads. We have to make sure that the resources that we have are valid resources. And that's what I think is most important for us, just to maintain the balance of understanding all the new information that comes in. So yes, it is up to 4 hours. So, being protective and understanding that for yourself is important to know, but don't just start listening to too many sources to figure out, what you think you know about it.
Right. Okay. So, this person is saying, I have sickle cell disease and I don't know if taking CMOS is the right thing for me. Should I be taking it to give my immune system a boost?
I love CMOS. I have some right here that I've been practicing with and taking for a couple of months now, and I totally feel the difference. Of course, anything is too much, so I say just in moderation. If that's something that you really want to do your research. You can even talk to your doctor about that. But I recommend it, and I think just 1 or 2 tablespoons of it a day really helps to boost your immune system. So I think it's a great idea. You just have to make sure that you understand if it's good for your body or not. I noticed an instant change. I don't know about you, Jason, but I've noticed an instant change in my digestive process. and how I wake up and get things moving and what happens with that, because you're supposed to take it on an empty stomach when you wake up in the morning. So researching things that you're going to put in your body, you know, not just listening to us or hear what we say, but these are things that I would be promoting and suggesting to everyone before, or, you know, even after we get through this coronavirus time.
So now this person's asking, is a tight or sore throat a common symptom of the coronavirus? I haven't heard that.
No, it's not a common symptom of the coronavirus. It's more or less about the coughing, you know, the shortness of breath. I don't think that's not really being a sore throat as a symptom of it. No, I wouldn't say it is. Just more or less the coughing, sore throat, and the fever, the constant high fever are more of the most common symptoms.
So this person is saying, how do you know for sure you have the coronavirus or not just a cold or fever? I mean, like, when should people start taking their symptoms serious?
We should take all of our symptoms serious right now. We almost want to act as if or assume that we do have it, because we've seen so many trends of people who have the virus and they don't have any symptoms. And that's what, you know, or the carrier, and you can pass it. So, you know, not knowing is the part that we're kind of struggling with right now. And I think that's the part that we have to be more patient with and allow us to take care of everyone who has these symptoms, who are severely ill, who feel it and can tell. It's not like whether you're questioning or not. At the same time, you're pretty much, once you are, you know, wondering if you have the virus and you haven't been tested yet, the doctors who I say call, but at the same time, don't just show up. You know, we talked about that a few days ago. Don't just show up at the doctor or the hospital just asking or demanding a test. You really need to just, you know, stay self-quarantined. Keep yourself at home, keep yourself away from people within your home if that's what you think, and just really stay in contact with the doctor. I've even told my friends and family to contact me if they feel something or, you know, have questions about that. So you don't really know for sure until you get the test done, but there's difference between, you know, flu and colds and then having that virus, which is a form of it.
But there, you know, I've told you that I think I got exposed to coronavirus before everybody started talking about it. Like, I remember that cold that I had in December, January, that was really, really, really bad. I mean, like, I remember I was calling you, I thought I was out of here, you know, but now I'm seeing that they're saying that people who've had it can have it again, but that they're now treating people who have it with people who have the antibody in their system. How do we get tested for if we've had it? Like, how do I know if I've had it? Like, can I go get tested for that?
You're not going to know right now because that testing wasn't done for when you were sick before. We can't go back to it. You know what I'm saying? And you're going to have new symptoms, new feelings, new things that help you realize whether it was that or it could possibly be the coronavirus. So you can't go back and do the testing and see. It'll still be your system, but that's how you kind of can be able to tell.
But would you be able to see if the antibodies in my system now?
Yes, you could. Yeah, basically.
I can do that through blood?
You could do that through the blood or the swab as well. Yes.
I need to text my doctor and get that done today. So I need to know.
You can do it, and they, you know, they allow it. You know, it's all really about the timing. I think by now, I posted a couple of days ago, just the prioritizing of, you know, who can get tested or not. I've seen a lot of celebrity clientele, people who are getting tested because they have the hookup like that. So, you know, there's possibilities to get it done.
I got the hookup too.
I think you got the hookup like that. You should be able to get it done.
Yeah, I'm gonna figure that out. Okay, so does it make sense to wear masks when you go out? Like, I went out for a walk with a friend of mine, and my friend had a mask, but I didn't have a mask. Should I have a mask when I go out?
If you have access to a mask, yes, you should wear it when you do go out. It's not going to hurt you to have it on. So I say wear a mask, wear gloves. I have some masks and gloves by my door. So when I go in and outside to take care of my dog or to work out, then I'll be able to just, again, we have to come up with these daily habits. It's not really going to change. So I say get into the habit of having that. I was asked some questions about that yesterday. It's important if you're going to be social distancing to still have a mask. I mean, you know, to me, it's better safe than sorry, right? It's not going to hurt you to have it on or to make sure that you know that you're always staying as protected as you possibly can, because the virus is small enough. You know, we have to look at it through a super duper microscope to be able to even see it. So there's still going to be some transmission that can happen. We just want to cut down that spread. if someone sneezes and they have, you know what I mean? Like, we want to do as much protection as we can. So at first I was telling you masks aren't really necessary. That was only because there was such a big shortage of them and everyone was going around, you know, buying them or ordering them. And now we don't have them for the medical professionals. That's not okay. So that's why I originally said we didn't need it. But now that we're in a place and we have a little bit more access to them, I say wear them, wear the mask, wear the gloves. I keep gloves on me anyway. So I always have them, you know, if you have them, wear them. When you clean up and when you clean your door handle, when you come in and out the house, I have my gloves on. It just, again, for me, I'm in the medical field, so it's a little different. I normally have gloves, but if you do have them, wear them. They're only going to help you.
So someone's trying to ask a simplified question. So like in terms of it being airborne and them catching it, if somebody coughs in a store, I use the analogy like the hallway in my building, right? If somebody coughs in the hallway and then you walk out 2 hours later, it could still be in the air for you to catch it?
That's what airborne is. That's what airborne is. Those are the chances that we take when we leave out, right? But yeah, that's 6 feet, understanding that distance. You don't know. We all of us are clueless. I know a lot of guys. We heard, who was that, Slim Thug earlier, that's been positive for a coronavirus, and he feels like he did everything possible to be safe. And so because there is that piece of information that we don't have enough knowledge about, then we have to kind of understand the risk that we're taking. And that's why it's so important for us to find a way to just to be home as much as possible. But going outside is like a healthy thing to do. You know, we need the sunshine that helps us get that vitamin D, especially us over here in LA or California, where we get a little bit more sun than everyone else. I say use those things as much as possible, but just be protected and safe and away from people is really how we can look at that.
So what this person's asking, what do we do if we live with somebody who is an elderly person? Like, what can we do to keep them safe?
Do the social distancing within your home. Make sure that they have the food and the medication that they need, you know, knowing that my grandmother lives with others. That didn't really sit well with me, but I just check on her daily. And I tell everyone to stay away from her. You know, grandma, spend your time doing the things that make you feel good, read your Bible, stay away for just a little while. I think it's very necessary over these next few weeks to keep your distance from them, you know, and just stay protected, stay clean, kind of like over clean, you know, over clean. If you're going to be with elders, not only practice the social distancing within the home, but do a better job of cleaning up and making sure everybody is staying as healthy as possible within the house.
So someone's asking, can you reuse a mask? Or do you have to use a different mask every time?
Mostly all the masks are single-use masks. Yes, that's a good question. You're not really supposed to use the mask more than one time, so no.
Damn, well then you have to have multiple masks.
Well, there's the one mask, what is it called? The
N95?
Yeah, those are cool, but I just feel like, you know, if something's going to get through viruses, they're so small, you know, so we have to understand that it's only limited amount of protection, anything like that is. But so if you have to use it, it's not going to hurt to continue to use it. But if you have options to have multiple ones, yeah, they're not supposed to be used more than once.
All right. So if you have a strong immune system, will you not get it, or will you get it and recover?
Both. It can happen. If you have a strong immune system, you can still get the virus. You know, I don't think anybody's really exempt from it. It's just about the matter of getting a strong enough immune system to fight off those things that you need to make sure that we're staying away from. So focusing on creating a healthy immune system, something that we need to do anyway. But yeah, the stronger that your immune system is, the better chances you have to fight it. So that's important to know.
Okay, so now just for people who want to know how to build a stronger immune system, so can you tell people like the supplements and the tea and all of the different things that they can do?
To strengthen up, so your immune system creates so much protection from you fighting off germs and infection, right? And it includes like all the different organs of your body that really helps to keep things moving. So one of my biggest things I talk about is probiotics. You know, do you have a probiotic that helps you create? There's an antibiotic, which is to get rid of bacteria that's bad, and there's a probiotic, which gives you healthy bacteria. So making sure that you have some form of a probiotic is, you know, a big part of creating a healthy immune system. Vitamin C and D, we already know that vitamin C helps you to create a healthy immune system as well. I say add D. D is something that we talked about yesterday. I take it every day. I encourage my athletes and my friends and family to take it every day, because brown skinned people do have high percentage of being vitamin D deficient, and that's where your immune system and your bone strength comes from. And so if we can have healthy bones, then we create healthy muscle, healthy tissue, and then that creates good, proper blood flow circulating through the body. So understanding the vitamin side, the supplement side, I really like still to take the CMOS. The elderberry is good for upper respiratory, so coughing, congestion, things like that. That's one of the newest ones for me that I've been looking into. I know some people have been talking about elderberry. Have you heard of that?
No.
Yeah, that's one that I haven't told you that I'm going to tell you today to add to your list of, you know, things that you should start thinking about, understanding a little bit more about them, as well as the black seed oil is some things that we want to make sure. Our brain and our hearts and our bodies all have to work together. So I'm really trying to focus on creating a strong mental, right? So I want my brain to be as strong as possible. So doing things that helps us, but also focusing on those supplements as well that really help to balance out our brain and our body's circulation, hydration, water alone. Water should be something. Yeah, where's your water? Where's everybody's water?
I'm drinking tons of water.
I always say if you're a water drinker, you have it on you. So who has it on them? I have two sources. I have my alkaline. I have my little Fiji. I'm feeling like I just can keep creating more.
But you know what's also going to be great at the end of all this? We're going to have the best skin.
Yes.
We're going to be so hydrated, have the best skin. And I'm telling you, the minute that this is over, I'm going to be on a plane out of here somewhere.
That's a fun fact, right? You got to make sure that now we know we have to drink more water. I like it because it doesn't make me have to remind everybody so much. Everyone still needs a reminder, but you know, now you get to get in the type of water that you drink. Those are fortunate enough to understand alkaline water or making your own alkaline water with adding lemon or lime to your water. I always told you yesterday about adding mint, adding different things to your water to help the taste, but also to help you feel like you can kind of consume a bit more. That's important as well.
Right.
So finding your focus on creating a healthy immune system, I think everybody needs to figure out what those 10 things are and just go at them real hard right now.
So listen, Courtney will be on tomorrow's podcast, Hollywood Unlocked Uncensored with Dr. McHale. So you can tune into that. You can watch it on YouTube. You can also go to the HollywoodUnlocked.com to watch it. And we'll be back here. We said we were going to do this Monday or Friday, but we made an error on the flyer and said every day. So Courtney, I'm going to see you every day at 11 o'clock.
I'm cool with that. It gets me up. I think one of our biggest things right now is that we're still kind of going through that shock phase. It's like, do we really have to stay home? Are we really not going to be able to work? Do we really have to change our daily lives? It's like, yeah, you do. But at the same time, you still got to do as much as you can do, clean as much. Get
up, shower, brush your teeth.
Yes.
Create a new world in your house. But be doing something so you look forward to something.
Yes, exactly. Look forward to something. I look forward to talking to you every day because I'm going to have to do it either way. So
I look forward to talking to you too. All right, Courtney. So I'm going to save this now. Everybody can watch it here. You can go to Courtney's Instagram, come back tomorrow at 11 a.m., take the flyer off our pages, share it, send it to friends. And thank you. I'll call you in a minute.
Okay. Sounds good. Thank you.
Bye.
Feel good, everybody.